Week 2. Stroke volume equals the volume of blood ejected with each heart contraction. Cardiac output is the volume of blood ejected from heart per minute. Cardiac output equals heart rate times stroke volume. Systemic vascular resistance is the pressure the left ventricle has to force blood against the vascular circulation. Blood pressure equals cardiac output times systemic vascular resistance. Autonomic nervous system. Fight or flight. Sympathetic nervous system increases heart rate, blood pressure, cardiac contractility, and vasoconstriction. Feed or breed. Parasympathetic nervous system decreases heart rate, blood pressure, cardiac contractility, and vasodilation. Baroreceptors are located in the carotid and aortic arch. They maintain blood pressure by signaling the parasympathetic nervous system and sympathetic nervous system. Adrenoreceptors are in the heart and lungs. They cause constriction and dilation of blood vessels. Cardiopulmonary baroreceptors are located in the heart and lungs. They maintain heart volume by signaling the sympathetic nervous system or the renin-angiotensin-aldosterone system, or RAS. Chemoreceptors are located in the carotid and aortic arch, and they fix hypoxia by signaling the sympathetic nervous system. Alpha-1 receptors are located in the arteries. They cause constriction. Beta-1 adrenoreceptors are located in the heart. They increase contractility. Beta-2 receptors are located in the lung. They cause dilation. When blood pressure increases, the sympathetic nervous system decreases and the parasympathetic nervous system increases. When blood pressure decreases, the sympathetic nervous system releases norepinephrine to stimulate the adrenoreceptors. Angiotensin II causes vasoconstriction and stimulates the release of aldosterone. Aldosterone increases sodium retention, causing water retention, and potassium is also released in the urine. This is the process of RAS. Measuring blood pressure. Manual blood pressure is the most accurate. Measure both arms using the higher reading. The goal is to prevent total organ damage. Primary hypertension, there is no known cause. Secondary hypertension, there is a fixable cause. Isolated hypertension is only systolic blood pressure is elevated. This still increases the risk for cardiovascular problems. Systolic hypertension is greater risk factor after the age of 50. Joint National Committee blood pressure guidelines. Normal blood pressure is systolic under 120 and diastolic under 80. Prehypertension is 120 to 139 systolic or 80 to 89 diastolic. Hypertension stage 1 is 140 to 159 systolic or 90 to 99 diastolic. Hypertension stage 2 is anything greater than 160 systolic or greater than 100 diastolic. Total organ damage from hypertension. The left ventricle hypertrophy, cerebral infarction or hemorrhage, hypertension, encephalopathy, kidney dysfunction, vascular damage, aortic aneurysm, aortic dissection, PVD, MI, eclampsia in pregnant women, and retinal hemorrhage. Hypertension urgency is anything greater than 180 systolic or 110 diastolic without total organ damage. Reduce the blood pressure soon. Hypertension emergency is anything greater than 220 systolic or 120 diastolic with total organ damage. You want to reduce the blood pressure immediately, but you don't want to reduce it too drastically because a sudden drop in blood pressure can cause cerebral perfusion decrease and may lead to a stroke. Initial goal is to reduce blood pressure by 25% within 2 hours. Next goal is to reduce blood pressure to 160/100 in the next 2 to 6 hours. Non-pharmacological treatment. Reduce weight, sodium, alcohol intake, and increase physical activity. Initial drugs for diabetics are ACE inhibitors or ARBs. Initial drugs for everyone else is either a thiazide, a calcium channel blocker, an ACE inhibitor, or ARB. ACE inhibitors and ARBs are not used for African American patients. Please look at the DASH eating plan. This is based on a 2,000 calorie diet. Sleep apnea symptoms occur with frequent and loud snoring, sleep deprivation and daytime sleepiness, the stopping of breathing during sleep, dry mouth when waking up, morning headaches, insomnia from inability to stay asleep. There are two types of sleep apnea: obstructive sleep apnea and central sleep apnea. Obstructive is most common sleep apnea caused by the blockage of airway, often causes loud snoring. Central sleep apnea, not caused by airway blockage. The brain does not signal the muscles to breathe and does not typically cause snoring. Combined is complex sleep apnea, a combination of both obstructive and central sleep apnea. Sleep apnea is strongly associated with hypertension and CHF. You want to treat the obstructive sleep apnea with a CPAP and central sleep apnea with a BiPAP. Cholesterol. Cholesterol comes from the food we eat and made by the liver. Cholesterol makes cell membranes, nerve tissues, hormones, vitamin D, and bile. Lipoprotein and what it does. Chylomicron, it moves dietary cholesterol and triglycerides from small intestines to tissues after meals. VLDL is made by the liver and converts LDL and is released into plasma. LDL is converted from IDL and carries cholesterol to peripheral tissues. HDL carries excessive cholesterol from the tissues back to the liver. Hyperlipidemia causes. They are caused by genetics, diabetes, kidney disease, liver disease, hormone dysfunction, lifestyle as obesity, alcohol intake, smoking, and not exercising. Cholesterol, fat, calcium can build up and form plaque along the arteries. Triglycerides are used for energy and levels increase after a meal. Your LDL cholesterol, the optimal is less than 100. Near optimal or above optimal is 100 to 129. Borderline high is 130 to 159. High is 160 to 189. And very high is anything greater than 190. Total cholesterol. Less than 200 is desirable. 200 to 239 is borderline high, and anything greater than 240 is high. HDL cholesterol. You want it to be less than 40. Low increases the risk. Non-pharmacological treatments. Decreased saturated fat intake. Increased fiber. Decreased dietary cholesterol. Decreased sugar and alcohol intake, and exercise. A lipid profile should be done fasting 12 hours for accuracy. You need to check every 5 years. Check within 24 hours of a hospital admission for any cardiac event, and a statin therapy is to be started before discharge. Medications. Statins. They are to be taken at bedtime. They can cause liver dysfunction. Patients should report muscle aches, weakness to rule out rhabdo. The goal is to reduce the LDL by greater than 50%, increases your HDL, and reduces TG and CRP. Bile acid sequestrants. They interfere with the absorption of other drugs. You want to make sure that you take it 4 to 6 hours after. You're going to take it 1 hour after taking your medications, or you're going to take your medications 4 to 6 hours after taking the sequestrant. It reduces LDL by 15 to 30%. It increases HDL by 3 to 5%. Niacin. It reduces LDL 5 to 25%. It reduces TG 20 to 50%, and it increases HDL's 15 to 35%. Cholesterol absorbent inhibitors. They reduce LDL by 18%, used when statins are not tolerated. Fibric acids. They reduce the LDL 5 to 20%, reduce the TG 20 to 50%, and it increases HDL 10 to 20%. Congratulations, this is week 2.